Hi, I'm Dr. Tyler Slaughter, and this is my wife, Kimberly. I'm the dentist at Riverbend Dentistry in Jefferson City, Missouri. My wife, Kim, is the practice administrator here, and we're going to answer some of your most common or frequently asked questions today.
We have about 10 questions that we get all the time, either here in the office or on the phone when people are calling to schedule. So we're going to call in some help from some people that we know to help ask those questions.
Will it hurt?
Will it hurt? Well, it depends on what we're doing, but hopefully no. The goal is always that you don't have any pain while you're here. So whenever you're getting your exams and cleaning, you shouldn't have any pain or discomfort with that. Whenever we're doing fillings, extractions, implants, whatever we need to do that day, our ultimate goal is always to make you feel as comfortable as possible. We always use anesthetic to get you numb so you can't feel anything. No one likes shots, so with shots we try our best to minimize pain there. We use our topical jelly, which gets your tissue numb, and we also have a dental vibe, which is a device which shakes your gums really hard whenever we give you the shot, and it really takes away a lot of the pain. So we're trying our best to do everything we can as painless as possible.
Yes, people are often concerned if something will hurt, but we assure you that we'll listen to your feedback during the whole procedure to make it as comfortable as possible.
Why do I need X-rays on my teeth?
So I read recently in a journal that a dentist probe, their little stick that they feel around in your teeth, feeling for sticky spots, is only 20% effective sometimes in finding those spots. So let's talk about why we need x-rays to see between your teeth.
So whenever we're taking x-rays, generally we're looking for things that I wouldn't be able to see when I'm looking in your mouth. So when I'm using my probe, I'm pushing on the top of your tooth, I'm pushing in any grooves of your teeth or any imperfections that look like they're stained or discolored, and I'm checking to see if they're soft or sticky. So those are things that I can see and kind of push on and feel, and generally you guys can feel too. So when I push, if it sticks, if my instrument sticks in the tooth and it feels sticky, or it kind of gives me a little tug back when I'm pulling away my instrument, that's an indication that you have a cavity. But for the spots that I can't see, so underneath crowns, underneath fillings, or in between your teeth, those are areas that sometimes I can't see, and sometimes you can have larger cavities. So x-rays are meant as a precaution to allow me to see anything that I can't see when I'm looking in there.
And now x-rays are so low radiation, there's no concern about frequency. There's lots of fun facts out there about how a lifetime of dental x-rays is still less radiation than living a year in Denver and things like that, and eating bananas and so on. So they're perfectly safe, and we typically recommend doing most x-rays annually, and some special x-rays like a panoramic x-ray that goes around your head about once every 5 years.
Hey, do you take insurance? Ah!
That's a question for me.
Not me.
We are happy to accept any private insurance. However, we are only in network. That means contracted with Delta Dental as a premier provider. So what that means is that if you have something else, MetLife, Blue Cross Blue Shield, we will submit on your behalf to those insurance companies, but we aren't contracted with them. Most of our patients are actually out of network or self-pay, and those patients find that if they would like for us to pre-authorize any larger treatment, it helps put their mind at ease that they will have great coverage, and we will do our best to maximize their benefits no matter what they have. But for patients who have very lackluster insurance plans, and there are a lot of them out there, then there may be a larger deductible or co-insurance left over, and we're happy to help patients find third-party financing through great things like Care Credit and Be Well. They're very reputable companies who can offer no-interest financing for 6, 12 months, and sometimes much longer, and we're happy to help with that application whenever patients need it. And for patients who decide that their insurance really isn't worth it, then if you ever decide to drop it, we have a membership program, our dental wellness membership for self-pay patients, that gives you a really great discount for being a loyal Riverbend member.
If someone hit my tooth, what do I do?
Depends on how old you are, I guess. So if you're a kiddo, a good rule of thumb is if you see the tooth changing colors, that's an indication you might need to come see us. Whenever a tooth changes colors, it can That doesn't necessarily mean we need to take action there. So if you fall and chip a tooth, we can always repair that. But if a kiddo falls and bumps a tooth hard enough to where over the next couple weeks or months you get an abscess, or the gums get puffy, red, and inflamed around the tooth, that's typically what I tell parents to look for.
It's probably the number one question that I'll get by Facebook Messenger, middle of dinner, pull up my phone and there's a broken kiddo tooth, and that's the automatic answer is that we can take an x-ray and check it out, but a lot of times you'll just want to watch in their gum line for, it basically looks like a pimple, like a whitehead, and that's basically an infection, and our kid, 3-year-old, had one as well, so it happens, and at that point we would talk about what we would need to do next. So just give us a call or message me by Facebook. And if you're an adult...
If you're an adult, it's a little easier. If the tooth hurts and it's painful, we need to address it immediately. If it's chipped, we can get you in as soon as possible to try to make it look nice. But
and if it's broken too bad, then we go down that road of what other treatments needed. If it is root canal and crown and things like that, usually you would need an x-ray.
What is the dentist tooth every year?
So standard of care is that you would come 2 times a year for most patients. Some patients who have extensive gum disease may actually be more, might be more 3 to 4 times a year. But for most happy, healthy people, twice a year is enough. And if you're a few weeks late,
no big deal.
No big deal. Some people feel so guilty about that, but it'll be okay. So 2 times a year, 1 appointment, we would probably do your annual x-rays, your exam and cleaning, and then at the next one just the exam and cleaning, and just keep an eye on things that we want to watch or identify anything with active decay.
Yeah, so getting cleaned every 6 months and x-rays once a year. So that's pretty much the standard of care.
And people are often really concerned about whitening, and if you're not coming at least twice a year, then kind of doing yourself a disservice, because it can really help to take off a lot of those surface stains that you can't take off at home. So it will help making your teeth, it'll make your teeth whiter in general, and also help whitening at home or in the office if your teeth are nice and free of debris.
I have to have a deep cleaning on my teeth.
Not every patient needs a deep cleaning, we hope not, but the fact is that over half of the adult population in the United States has some form of periodontal disease, and we try to catch that and catch it early. If you haven't been to the dentist in a while, there may be a chance that you would need one, and Tyler can tell you how we find out about that. But it's important, if you do need a deep cleaning, to go ahead and schedule that. There is a lot of research that shows that gum disease not only affects but has a causative relationship with heart disease,
Diabetes,
stroke, pregnancy. Gum disease can affect you and the unborn baby, so people often just see their teeth as disposable and they can just get rid of them and it's not a big deal, but really what's going on in your gums is a direct line to your bloodstream. So if you have active gum disease or active decay, then that's running through you or your kiddo's bloodstream 24 hours a day. So our hygienist will go through a process to find out if you have healthy gums or not.
So they use a probe to see how deep the pocketing around your
doesn't
tooth
hurt.
is between your tooth and your gums. And if you have deeper probing depths or heavy calculus, which is a hard buildup that connects to your teeth, you might need a deeper cleaning. So to get some of that stuff off of your teeth, you cannot get it off by brushing, you cannot get it off by flossing. So taking a step back and getting you numb and sometimes getting that stuff off of there can really not only improve your oral health, but your health in general. And sometimes that's necessary.
I don't have insurance.
We have many patients who are self-pay, and we have a really great membership program that we developed for self-pay patients. You don't have to do it, but if you'd like to, you pay an annual amount that covers both of your cleanings, your exams, and x-rays, and with that you get an additional amount off of almost anything that we do in-house: fillings, crowns, extractions, promotional price on whitening at any time, and you save even more if you add additional family members within the same household. So it's for kiddos and adults, and we find that for many of our membership patients, it's a much better deal for them rather than paying an insurance premium. It's not an insurance though, so if you have insurance, we can't add it, and it's just really a loyalty program to thank you for coming twice a year and doing all of your services with us. And if that doesn't work for you, and potentially you need some bigger treatment, you know, an implant or maybe a couple of crowns, then we're happy to help you apply for financing with companies like CareCredit or BeWell, and they have many no interest payment options, and their customer service is wonderful. So we have applications here, or can help patients fill out online. And the healthcare credit card, CareCredit, is often used at many other doctor's offices and vets and hospitals. So you can use it at many places and make one payment a month, and everyone is happy.
Sprinkles and sprinkles and sprinkles. Do you take payments?
That's not my forte, so Kim.
Payments are hard. We understand everybody has a different situation, but it's our contractual obligation to collect a patient's deductible and coinsurance at the time of appointment. So we tell patients you can prepay as long as you want. So if you have an appointment coming up in 4 months, we're more than happy to help you put some money onto your account each month and save up before your appointment, and that works out really well for some families. We also have third-party financing with CareCredit and BeWell. And again, as I've mentioned, maybe in one or two other questions, that we have a membership program that would help get you the best pricing that we can give for loyal patients. But unfortunately, we're not a bank, and so we can't take extended payment plans, but we try really hard to maximize insurance and do what we can to make care affordable and attainable for everybody.
What if my dentures fall out?
So you may have seen a viral video of a sweet grandma who's playing a game with her grandkids, and they're laughing and having a great time, and then her denture falls out of her mouth. And we can kind of all laugh that it's funny, but unfortunately that's very embarrassing for most people if that happens. And fortunately, technology has gotten to us to a place where we can have a solution for that that won't it still is an investment, but it won't break the bank. So.
Sure. Sometimes traditional dentures work very well for people and they're very happy with them, but a lot of times, especially with lower dentures, there's not a lot of retention. Your bone and your tongue and your lip, they don't retain your denture very well. So we have implants now, whereas 15, 20 years ago, if you had a lower denture that didn't fit well and it came out a lot, you really couldn't do a lot about it. Now we have a lot of options. We can put in implants that simply have buttons on the top of them where your dentures can snap in and out, and that can provide a whole world of possibilities as far as retaining your dentures whenever you're speaking, eating. You can eat different foods that you haven't eaten. Also, you can have implants that simply replace your teeth. You can have teeth that never come out. They're your natural teeth.
So with an upper denture, there is usually pretty good suction to the top of your mouth. It's solid, and then the bottom one looks like a horseshoe because you have a tongue, and so it doesn't have much to hold on to. So patients are usually more unhappy with a lower denture and might want to look at some other options. Especially we do have a lot of younger patients, unfortunately, with dentures. You know, life happens, and we want to get them to where they're confident with the smile that they have, so they can meet the person of their dreams or get their dream job or whatever it may be. So implants, you don't have to do every tooth, is an option to just help secure that denture so you can eat the foods you want, taste the foods you want, not worry so much about it slipping around and falling out. Also, when you have an implant retained upper denture, they cut out the middle part on the palate on your upper mouth, so it just becomes a lot less bulky and helps you speak and eat foods a lot easier than a traditional denture.
Why choose Riverbend Dentistry?
we're going to do everything that we can from the moment you enter the door until you leave to make you as comfortable as possible, to make your experience as good as we can. I know coming to the dentist isn't fun. That's pretty obvious. No one wants to spend time with me when you could be doing other things.
Some people like getting their teeth cleaned, but
we will
not
do
many.
everything we can to put you in an environment where you feel safe, you feel comfortable, and we try to stay pretty loose around here where people try to have a good time at the dentist.
Tyler actually came up with dentistry done differently back when we first opened, and we take that pretty seriously, and not just when you walk in the door. I'd argue that it's different even when you call. I'm very reachable by Facebook Messenger, by email, as far as answering questions and helping patients to become informed patients so you can make the best decision. I think we get a lot of great feedback that we're not pushy and that we help to educate and that we are pretty just kind of fun. We hang up birthday decorations and sometimes have a dog running around in the back, and that's how we like it. We're a family business, and we might have our kids here some days, for better, for worse, and we're really happy and proud of what we do and hope that we can help make a healthier population in Jeff City by helping them to take care of their teeth. I joke, it's on our Instagram, find us on Instagram, that we help people to not hate the dentist one patient at a time, and we mean it. It's so much fun to read our Google reviews and Facebook reviews of patients who, I said today, I love getting a phone call from somebody who hasn't been to the dentist in 8 years because they're afraid, because I know that if they come in, it will change their mind and it will help improve their overall health, and I mean it, and people write about that in the reviews, and that Tyler helps them make an informed decision, that he talks to them like a family member, and that we're not pushy, we're not selling something, and we're proud of what we do every day, and it will always be a family business, and we treat everybody, including our team members, like family. I hope you learned something in our frequently asked questions. If you have any follow-up questions, you can always call, email, or Facebook message us, and we're happy to get back with you as soon as we can to answer all of your questions. Even if it's on a weekend, I try really hard to get back with you as soon as I can. And we just want to say thank you so much for choosing Riverbend Dentistry.
Thanks for being part of the Riverbend family and watching our frequently asked questions.